ASCP Phlebotomy Technician Practice Test 2025 Updated New Real Exam Questions Answers Explained. Question 1. Hemolysis can be caused by using a 21G needle, shaking the tube vigorously, drawing from the median cubital, inverting the tube 5 times. Vigorous shaking destroys RBCs. Question 2. A patient should be in what position for blood draw? Prone, standing, seated or supine. Trendelenburg. Seated or lying down for safety. Question 3. The most common vein for venipuncture is cephalic, basilic, median cubital, radial. Median cubital is first choice. Question 4. Blood cultures are drawn first, last, after SST, after lavender. Drawn first to maintain sterility. Question 5. Glycolysis is prevented by which additive? EDTA, sodium citrate, sodium fluoride, SST. Sodium fluoride, gray top, preserves glucose. Question 6. Maximum depth for a heel puncture. 1 mm, 2.0 mm, 3.0 mm, 5.0 mm. 2.0 mm to avoid calcaneus. Question 7. What happens if a tourniquet is left on for 1 minute? Hemoconcentration, hemolysis, hematoma, petechiae. Prolonged stasis leads to hemoconcentration. Question 8. What should be done first if a patient faints? Finish the draw. Call a code. Remove needle and tourniquet. Give them water. Safety first, stop the procedure immediately. Question 9. Syncope means heart attack, fainting, vomiting, bleeding. Medical term for fainting. Question 10. Which tube contains heparin? Lavender, green, light blue, gray. Green top tubes contain heparin. Question 11. Needle insertion angle for venipuncture. 45 to 90 degrees. 15 to 30 degrees. 5 to 10 degrees. 0 degrees. 15 to 30 degree angle is standard. Question 12. Which tube is used for coagulation tests, PT/PTT? Lavender, light blue, red, green. Light blue, sodium citrate. Question 13. Appropriate site for infant heel stick. Center of heel. Medial or lateral plantar surface. The big toe. Arch of foot. Safe zones to avoid bone injury. Question 14. Post-draw, how long should pressure be applied? 10 seconds. Until bleeding stops. 30 minutes. Until hemostasis is achieved. Question 15. What is the antiseptic of choice for routine venipuncture? 70% isopropyl alcohol. Povidone iodine. Soap and water. Hydrogen peroxide. 70% IPA is standard. Question 16. Wiping away the first drop of blood is standard for venipuncture, capillary puncture, arterial draw, blood culture. Removes tissue fluid and alcohol. Question 17. Which tube is used for a CBC? Green, red, lavender, light blue. Lavender, EDTA, is for hematology/CBC. Question 18. What is the purpose of the additive in a tube? Change color. Prevent or promote clotting. Increase volume. Keep blood cold. Additives serve specific chemical functions. Question 19. What is the correct order of draw for these tubes? SST, lavender, blue. Blue, SST, lavender. Lavender, blue, SST. Green, blue, SST. Light blue, citrate, SST, serum, lavender, EDTA. Question 20. The bevel of the needle should face down, sideways, up, any direction. Bevel up for easier entry.